have a very insightful talk by Dr. Nivedita Prabhu. Ma'am is working at Manipal Academy of Health Sciences and she's looking after the onco rehab of the patients. She is a physiotherapist by profession. We welcome you, ma'am, and I request ma'am to start her talk on impact of the risk factors on cancer and role of physiotherapist for the prevention of the same.
Thank
Over.
you, Suroshri, for that introduction. So I'll be speaking on briefly about the impact of risk factors in the development of cancer and the role of exercise in the prevention of these risk factors. So risk factors ideally can be of two types. So you have intrinsic risk factors and you have extrinsic risk factors. So in case of intrinsic risk factors, it's mainly the genetic makeup of the person. There are certain genetic profiles which are more prone to cancer. So, if there is a very strong family history of cancer, if there is some kind of a genetic makeup in which there is a probability of some kind of mutation of the genes in the body, so that can lead to the formation of cancer. So, a familial history or the history of cancer in the family can very strongly predispose a person to cancer. So ideally, if both parents are or have had a history, or any of the grandparents in your pedigree have had a history, so then in that case, the probability of uh, the development of the disease is much higher. So ideally, a genetic profiling is done, and in that case, we get to know if the person is at a higher risk. So if both parents or the both the lineages of the parents from either side have developed, that's the mother and the father, have had a family history, then there is a probability of cancer developing. So those are more of the intrinsic factors. When it comes to the extrinsic factors, these are modifiable factors. Intrinsic factors are mostly non-modifiable. So, apart from the genetic profiling, you have age, you have gender, you have certain chromosomal issues or chromosomal diseases which the person may be already having, which will again subject that person to development of some particular kind of cancer. So, in case of extrinsic factors, you will have or extrinsic risk factors. These are completely modifiable. So if an initiative or an initiation is taken by the person himself or herself, uh, the development of that particular cancer can be avoided. So I'll be just covering few of them which are more relatable to the physiotherapy perspective. I'm not saying that there are no other risk factors. There are multiple risk factors which are there. So um, there are multiple risk factors. So if you'll see this diagram, you have age and sex, which is again non-modifiable. Sexually transmitted diseases, this is again lifestyle-based. Genetic and epigenetic modifications, this is again non-modifiable or intrinsic. Ionizing radiation exposure, certain surgeries, okay, pharmaceutical treatments, these are all modifiable. So you can still, avoid certain risk factors or avoid exposure to certain, factors which can predispose a person to development of cancer. So diet and vitamin deficiencies, this is again a nutritional aspect, which is also a risk factor in the extrinsic form. So if possible, it can be addressed and the patient can be counseled or the person can be counseled if they are having some kind of nutritional deficiencies or exposure to high amounts of certain kinds of nutritional components which might predispose them to to cancer. So menstruation, menopause, and childbirth again is non-modifiable. So in this case, the menarche and early menarche and late menopause ideally is sometimes considered to be a high risk factor for development of breast cancer or any kind of gynecological cancers. Then you have alcohol consumption and smoking, which is again modifiable. Tissue architecture again is non-modifiable. So if you see this diagram, you have uh, the alternate factors which are intrinsic and the next alternate factors which are extrinsic. So ethnicity and family history, we cannot do much about it. Obesity and inflammation, yes. Obesity again now is on a rampant spread, especially in India. So what is happening is because of the excess amount of junk food and fast food and lack of physical activity, there is a very high prevalence of obesity or at least overweight happening in younger children, the younger generations. And probably for the times to come in another 10 years or 20 years, the prevalence or incidence of cancer might increase further. Environmental pollutants and exposures to certain pesticides, certain kinds of environmental pollutants, toxic fumes and gases, all that can make a person susceptible to the development or susceptible to cancer. Lack of exercise or lack of any kind of physical activity. So physical activity and exercise are not the same thing. So exercise is more of a structured kind of physical activity, which is done on multiple repetitions, which will help the person to strengthen the muscle or strengthen the bones and strengthen the skeletal framework and the musculoskeletal structure. So certain risk factors which I will be covering for this talk, preferably, which is very, very rampant right now in India based on the requirement. One is obesity, definitely obesity. So even if a person is overweight, uh, there is a very strong need now to address that issue. Physical inactivity, a very sedentary lifestyle, constantly, the younger generations probably are now, sitting with the phone, the cell phone, addiction to cell phones. So all that is actually adding on to a sedentary kind of lifestyle. Tobacco chewing and smoking. So the general public, majority of the lower middle class or the lower economic strata, so they are more susceptible to tobacco chewing. Smoking is still, it is still possible even in the higher class or higher economic strata. So in both ways, there is still a risk of the development of cancer, especially cancer or any kind of oral cavity cancers, depending on the modification that is required. And then you have the nutritional factors and alcohol consumption related to the diet perspective. So now, alcohol definitely consumption can lead to, alcoholic liver disease. But now, um, you also have non-alcoholic liver disease, so that you are having fatty livers which are non-alcoholic based. So there is a possibility of non-alcoholic fatty liver. So these kind of perspectives, and that non-alcoholic fatty liver is also again due to obesity. So you have constant, a sort of low-grade inflammation constantly happening in the body, which is eventually causing inflammation, and inflammation eventually leads to repair. So anything which is constantly inflamed and repairing itself, generating, regenerating, generating, and then dying off, and then regenerating. So cells are constantly being manufactured, cells are constantly dying and then getting remanufactured. So during this process, the probability of mutations are very high, and that can again lead to the formation of a cancer. So this is what I meant. So this is just an example of overexposure to ultraviolet light. So you can have factors which are genetic, lifestyle based, and the environment. So all these three in the Venn diagram, if you see, the combination of two risk factors can lead to a moderate risk. But when you have a combination of all three getting involved, there is a very, very high risk of the development of cancer. So when it comes to obesity, so this is the first part of obesity. I'm just showing you all a slide wherein it shows the mechanism and basically the pathophysiology of obesity and how it can lead to cancer and the formation of a cancer cell. So for this, we will have to go back into our basic physiology and understand. So unless we, as physiotherapists, are planning to give exercise, we have to understand the pathophysiology that is occurring in the body. So, as a preventive measure, exercise is an amazing kind of tool which does not have many side effects. And if it is planned well, it can prevent multiple, chronic diseases in one go. So you can prevent cardiovascular disease, cancer, any kind of other metabolic diseases. Everything can be prevented. So, in case of obesity, ideally, if you see the first box on top. So ideally, what happens? The top box, if you see, and the second box, if you can see from down. So you have expanded and reprogrammed metabolically active adipose tissue. So adipose tissue here gets reprogrammed metabolically, and you have increase in the pre-adipocytes. And these pre-adipocytes are again inflammatory cells that will increase the amount of leptin and free fatty acids. It will increase the amount of cytokines, which are again, a process uh, are a part of the process of inflammation. And again, you will have chemokines and cytokines, which are increased number, leading to increased inflammatory markers like interleukin 6 and the interleukins and other kind of cytokines. So that is a fat cell. The other side, the other aspect, you have altered systemic physiology. So here you'll have increased insulin resistance or, increase in the glucose. The blood glucose levels are going to increase, free fatty acids, lipids, adiponectin, which is actually considered to be a preventive uh, or anti-inflammatory kind of a marker, that is reduced, and leptin increases, which again increases the oxidative stress leading to inflammation. So you have increased amount of reactive oxygen species which are created, and that leads to oxidation, and that can again lead to inflammation. So increased amount of estrogen. Now this is a very, very strong finding which they have seen. So even in postmenopausal women, even after the estrogen gets, it comes down drastically. If the lady is obese or overweight and the amount of abdominal obesity is more, the adipocytes are able to uh, secrete or release exogenous, I wouldn't say endogenous, it's more of, exogenous estrogen. So estrogen is a pro-inflammatory hormone. It is extremely pro-inflammatory. So high levels of estrogen eventually can lead to, again, the chances of development of breast cancer. So here again, you will have increased amount of inflammatory markers. Then again, you can have a direct effect on the cancer cell, wherein the signaling pathway is there, and that can have, estrogen, insulin, the different growth factors which are there, and you have different NFK beta, JAK, STAT. All this will have a direct effect on the cancer cell. So the cancer cell actually is like a gateway. So it's like somebody opening a big gate, and the cancer cells are free to just go on multiplying. So there is no restriction there. So in obesity, what happens is it's like a nice environment, microenvironment for the cancer cells to grow, and that chronic inflammatory kind of an environment will help the tumor microenvironment to establish itself. So then that leads to the formation of a stromal cell and the development of the cancer cell. You have the macrophages there. So that constant inflammation is going to create indirect effects on the tumor microenvironment. And that will lead to increase in pre-adipocytes, cancer-associated adipocytes. So cancer itself will modify itself or mutate and form another kind of adipocyte, increase in the number of inflammatory cells, cytokines, and other inflammatory markers. So this is again just a brief, mechanism. So you will have the cancer cells which will induce lipolysis in the adipocyte, and that adipocyte will then lead. That adipocyte will undergo delipidation. So what happens here is it will become like a fibroblast, or it will have a fibroblast-like structure or phenotype, and that will form a cancer-associated adipocyte. So it will convert from a normal adipocyte into a cancer-associated adipocyte. And what will this do? This will improve, this will increase the amount of inflammatory markers. This will increase the amount of inflammatory cytokines. Again, there is inflammation. Again, there is repair. And new cancer cells will again form. So when there is inflammation, the blood flow increases. When the blood flow increases, the cancer can again spread, and there is a high amount of nutrition being received by the tumor microenvironment, and then further it will go on spreading. So that leads to acquisition of the invasiveness and aggression of the cancer cells. So those adipocytes are going to support and grow, the growth of the cells, and also the metastasis can happen. So this is another simple chart. It's not, please don't get confused. It's just a mechanism wherein certain adipokines, cytokines, TNF alpha, IL-6, interleukin 6, and multiple other factors cytokines get stimulated, and they start secreting more, and that will increase the inflammation in that area. So now how does exercise help in all this? Exercise is extremely anti-inflammatory. So it has been proven to have extreme anti-inflammatory effects. It can suppress the cytokines, it can suppress the adipokines, it need not. And because of the core temperature rising, the oxidation of the fat cells will help in metabolizing the fat cells, and thereby breakdown of the adipocytes will occur. The fat gets utilized by the exercising muscles, and thereby the inflammatory process itself will come down. So if abdominal obesity comes down, especially in certain areas where the obesity is more, the fat cells are more. If that is reduced, the chances of estrogen and other kinds of cytokines getting released will come down. So eventually, in the extracellular matrix, you will have less amount of stiffness, and the interstitial pressure, everything will come down. Okay, so that's about obesity and as a major factor, risk factor right now for cancer. And next we have oral cavity cancer. Now this is mainly one of the lifestyle related risk factors, which ideally through education and a lot of counseling would require, it can be stopped provided the patient gets convinced in terms of. So by the time the damage is already done, it may become irreversible because nothing much can be done. But it is always better to create public health awareness programs to, uh, stop tobacco chewing and smoking. So here again, if you see, it's a vicious cycle wherein tobacco can lead to. So if a person already has certain epigenetic factors which predispose him or her to developing cancer, a person who's chewing tobacco, it is going to cause further localized tumor formations in the oral cavity, wherein the amount of tobacco or the uh, tobacco which is being chewed is releasing certain kinds of carcinogens, which is causing damage to the mucosa and constant inflammation in the mucosa, which eventually leads to formation of the cancer. And again, environmental exposure, consumption of alcohol simultaneously, malnutrition, all this contributes to. So antioxidants are less in the body. Person may not consume that many amount of antioxidants. High amount of sugar and carbohydrates in the diet. All this can contribute to the formation of cancer cells. So in case of oral cavity cancers, there are other risk factors as well. So not only the tobacco chewing, tobacco and alcohol as a combination, betel quid chewing, personal history of head and neck cancer, if already it was there, if any family history of head and neck cancer was there, nutritional deficiencies in the person and in the family, oral infections, if any. So candidiasis, any yeast infections or oral cavity infections, radiation exposure, chronic irritation, dental hygiene is poor. All this can lead to, these are all supportive factors which can add on to the formation of the oral cancer. So how does exercise help? Even in case of oral cavity cancers, again, yes, after the surgery, there are multiple things that have to be done. So if the patient undergoes any kind of head and neck surgery, especially neck dissections at different levels, there are a lot of musculoskeletal issues that the patient will develop, and accordingly, each area will have to be addressed. So the neck, in terms of neck mobility, the tissues which are involved, the muscles which are involved, the shoulder or the entire upper quadrant of the dysfunction of the upper quadrant has to be addressed in terms of the head and neck and the shoulder. Any kind of gross motor issues or fine motor issues in terms of the brachial plexus, if anything is involved, all that has to be addressed. So in terms of exercise, if I'll just see this chart, uh, since, since you were talking about obesity also, so exercise helps in insulin sensitivity. We know that. Okay, hyperlipidemia comes down. Mitochondrial function also will improve. Chronic inflammation definitely improves, comes down, which means chronic inflammation is one of the major factors. Low grade chronic inflammation is one of the main factors for development of cancers right now. And it also improves the muscle mass and strength. So chronic, um, I mean, the chronicity should be towards an exercise like based lifestyle. So regular aerobic exercise and intermittent resistance exercise has been shown in many clinical trials to improve the lipid levels in the person, reduce the number of inflammatory markers, and thereby prevent cancer in the long run. So physical activity and cancer will definitely reduce your risk, and at least 150 minutes a week of exercise, regular exercise, would help in prevention of cancer. So this is given by the American Institute of Cancer Research. And for more protection, ideally be active for at least 45 to 60 minutes per day. So being physically active reduces the risk of breast cancer, colon cancer, endometrial cancers. Um, It may also decrease the risk of liver and esophageal cancers, improve survival after breast cancer, and it can help with weight control and improve the quality of life. So that is the preventive, I mean, that is the preventive mode of exercise, wherein as a preventive mechanism to reduce or address the risk factors, we are intervening at that time. So it forms as a part of prehabilitation. So you're in the preventive stage of cancer rehabilitation. Exercise also helps during the treatment of cancer. So any kind of chemotherapy or radiation therapy induced any side effects, or hormonal therapy, immunotherapy, targeted therapy. So there are multiple types of therapies which are constantly going on for a patient with cancer. So in such cases, there are multiple complications that can occur, uh, which follow the medical treatment. So exercise is also helpful at that stage. So we call it as restorative and supportive kind of method, wherein we ensure that um any kind of complications that are there, those are addressed prior to uh, when during the course of cancer treatment. So it reduces certain things like cancer-related fatigue, improves the range of movement post head and neck cancer surgery, improves tolerance to the treatment, bone density. So the bones get extremely fragile. Osteoporotic activity might ensue, especially postmenopausal. In addition to the menopause and addition to the chemotherapy and radiation therapy, the bones become extremely weak. Patient may complain of a lot of issues in terms of weakness, uh, inability to walk or even be physically active. So there again, based on the risk stratification, the patients can be treated with regular exercise provided they are monitored and supervised. So it reverses any kind of deconditioning, increases the chances of survival, and then it improves the immune function. So immunity is very, very important to control any kind of recurrence of cancer. So the immune cells are able to identify cancer cells, and at an early stage, if they're able to identify, they'll be able to kill them. So that would actually help in responding, early to the stages of cancer. So restoring the aerobic capacity and improving their psychological state of mind, everything would come down. I mean, would improve. And then, especially in women and men now also who are on androgen deprivation therapy also for prostate cancers. So it improves the pelvic floor function. So if they are on brachytherapy for prostate cancers, for example, brachytherapy is where they put tiny pellets of, the radiation kind of seeds, which are implanted near the prostate gland or inside, which would directly provide localized treatment and kill the cancer cells there. In such cases, they may have certain pelvic floor issues, which can be addressed through exercise. So improves the balance and also reduces the recurrence. So these are mainly the um effects of exercise. So this was one of the infographics which was released by Cancer Research UK, which I found very nicely explained related to the risk factors. So if you actually see, make a change to reduce the risk factor, to reduce the cancer risk. So here, ideally be smoke free. Do not smoke. Drink very less alcohol. It is not even less alcohol. I would, suggest completely avoid alcohol altogether. Keep a healthy weight. Eat a high fiber diet. High fiber diet has been shown to absorb excessive estrogen in the system. If you're having any extra estrogen through your diet as well, that extra estrogen which is being released can get absorbed through the high fiber diet. Avoid unnecessary exposure to radiations like X-rays and certain high ionizing radiation areas. Exposure to UV rays should be also can be limited, and certain occupational hazards which might predispose a person to developing cancer, especially lung cancer or esophageal cancer, such as asbestos, certain chemicals or chemical fumes, and then protecting against certain infections. So that's why immunity is very, very important. Certain infections like human papillomavirus or H. pylori, which is a bacterium which can cause gastric cancer, and HPV can cause cervical cancer. So there are multiple viral and bacterial, which are also the biological agents, can cause cancer. So cut down on processed foods. processed meat or processed foods, which again may be having certain preservatives and certain chemicals or certain toxins in them, which might predispose a person to high inflammation and later on to cancer. Breastfeed if possible, especially for women uh, post-partum. So ideally, breastfeeding has been known to reduce the risk of breast cancer in future. Be more physically active and minimize hormone replacement therapy. So hormonal therapy and which is used for cancer therapy, hormonal therapy is not the same as hormone replacement therapy. So hormone replacement therapy is um, wherein they replace the hormones, but hormonal therapy is where the hormones are restricted. They are completely restricted or they are inhibited. So that is basically hormonal therapy. So with this, I conclude my talk. Um, if you all have any questions, I think you all can contact the team who is organizing this sessions of talk. They're taking a very good initiative. Um, Probably through them, you all can get my contact details. And if you all need any more further information, we can communicate. Thank you.
Thank you so much for such a wonderful talk. I'm sure that today, after this talk, after listening to this talk, our viewers must have learned a lot about the impact of the risk factors and, as a physiotherapist, how we can actually work towards prevention. So, thank you so much, ma'am, for your valuable time. And with this, I thank the Physio TV team. I thank the management, Mrs. Manisha Sangvi, our principal sir, Dr. Apurva Shimpi, and the Physio TV team, Dr. Fareen Patel and Dr. Shivani Chutke, for this wonderful session. Thank you so much.